So when we have patients with multiple myeloma, or we think of multiple myeloma patients, we usually visualize in elder patients. But we also have patients that are adolescents and young adults, age 15 to 39 years of age, which define that usually the NCI has this cutoff of age and help us as clinicians or researchers to segment the age groups and compare between them. So having that in mind, we wanted to explore if there were some clinical characteristics or sociodemographic variables that could influence the outcomes in survival for those populations, for youngers versus olders. So that research was done using the database of the C database of the NCI. And what we did is we took the patients only with diagnosis with myeloma and compared the 15 to 39 versus 40 plus. First of all, what we really did was a bivariate analysis between youngers versus olders. Then we ran an analysis only between youngers, trying to find if something meaningful there, and then over the 15 plus population, the whole population. So what we found that the younger patients do best in survival. This is something that has been seen before in some of the studies, but not all the studies. So this is something that reaffirms that younger has a better survival independent of other clinical characteristics like age, like gender, like income, like place of living, or different treatments received. So we know that age is a variable that for sure contributes in overall survival. Now, between the younger, what we found that the race, particularly the Hispanic population, do worse than other populations, than other races, but the other sociodemographic characteristics variables were not significant. That is different when we compare with the general population. In the general population, we found several variables that we know and have been described in the past, but this ratified that age, gender distribution, there are some racial disparities in favor of Asian populations, and there's advantage in people that have higher income. There's advantage in people that live in urban areas compared to rural areas, and having treatment exposures, of course, as expected, prolonged survival. So that's something that adds information for the literature at this time for the racial advantage and disadvantages, worse outcomes for the Hispanic population that are adolescents and young adults. I think that one of the most important things in my research is a call for the researchers that try to do cutoffs of age, to try to standardize using the cutoff using by the NCI. Because when we compare the results, for example, with my research using this cutoff, I cannot compare with other previous researchers because they use cutoff of, let's say, 50 years of age or 30 years of age. So if we use different cutoffs, we definitely cannot accurately compare between studies and have different drivers in the future design of clinical trials, because we usually try to find variables in those type of studies that could drive the recruitment, could drive the distribution in clinical trials in the future. So it's just a call to standardize the cutoffs, to do a better interpretation of the information, and then a better planning in the future for the clinical trials.